It's time once again for another episode of the Law and Medicine Show, being sponsored by the law firm of Princenthal-and-may. Broadcasting live from the Pro Business Channel studios in Atlanta. And now please welcome your host and their guests on today's episode.
Good morning, everybody. I am attorney Matthew Wilson. I'm a partner at the law firm of Princenthal-and-may, and this is the Law and Medicine Radio Show. It's a half-hour program in which we discuss the interplay between law and medicine, as the name suggests. Over the next 30 minutes, we're going to take an in-depth look at the relationship between what I do, which is personal injury law, and what my guest, Dr. Ray Weinberg, does, which is chiropractic medicine. Hopefully, in terms of the law portion of the program, I'll be able to satisfy that prerequisite. Just to give you a little bit of information about myself, was born and raised here in Atlanta, grew up in Gwinnett County, got my undergraduate degree from the University of Georgia, go Dogs, and went to law school at Mercer University in Macon. I'm a personal injury attorney, and our practice, Princenthal-and-may, specializes in workers' comp, personal injury, and wrongful death. Specifically, the majority of my practice focuses on motor vehicle collisions and slip and falls, which, though it sounds pretty straightforward, slip and fall law is a relatively complex area of the law and is highly contested. So if you have a slip and fall and I could throw my hat into the ring, I think you'd be wise by giving our office a call. Joining me today is my esteemed guest, Dr. Ray Weinberg. He is a chiropractor who specializes in trauma, disc, and injury rehabilitation, and has done so for the last 30 years. He's been voted favorite chiropractor by Best of Cobb magazine and was recently awarded Patient's Choice winner by Open Care. Dr. Weinberg has been a team chiropractor for various local, national, and international sports teams, as well as the chiropractor for the Atlanta Ballet. Good morning, Dr. Weinberg. Thank you for joining me.
Good morning.
Did I do a good enough job building you up?
I think you did the rundown there.
Tell our audience what I left out. Tell us some information about you.
Well, yeah, I'm from New York and did 4 years at State University of Stony Brook, and been in practice for, I'm going to date myself now, a little bit over 30 years. And for the last 16, we've had a practice on what was the Emory Adventist Hospital campus, which is now Emory at Smyrna, in the Smyrna-Vinings area. And we specialize in trauma. Trauma encompasses quite a broad scope. I would say primarily vehicular collisions, slip and falls are in there. Some work comp, unfortunately, comes with that, assault and batteries and some other things. And so we specialize in disc and shoulders and knees.
So I was saying earlier, and you just mentioned a lot of what you do in terms of treating patients relates to car accidents and slip and fall, trip and fall, that kind of thing. Why are back and neck injuries so prevalent with those types of injuries or incidents?
There's always two things to consider when an injury is incurred. There's always the magnitude of the injury, and there's the nature. And for the most part, most injuries incur some level of degree of soft tissue tearing. And when we talk about soft tissue, we're talking about the muscles, the ligaments, and the tendons. And instead of grouping all those in together, it's not to make this too visual. If you are eating a piece of chicken, the meat would be the muscle, and the piece of gristle that attaches that muscle, that meat to the bone, would be the tendon, and that piece of gristle is what holds the bones together. When you incur an injury and the range of motion, there's always a limitation. There's an extent of range of motion in a joint. In the injury, if that range of motion is exceeded, there's tearing of the tissue. And so you tear some of the muscles, the ligaments, and the tendons. And the body has its own natural way of healing that. Initially, the first 3 to 5 days, there's going to be what we call interstitial bleeding. it'll bleed, and which is the number one reason why we always stress to a patient who's just been in an injury, ice, because it creates blood flow and reduces the amount of edema or fluid that builds up within the joint. As those torn tissues start to heal, they heal with scar tissue, or we can call them adhesions. There's a buildup of a collagen. And if you don't direct that healing process, then the joint will heal restricted, fixated, and locked up. So the primary reason for rehabilitation after a trauma is to direct the healing process, because the adhesions or the scar tissue that forms within the joint will be inherently and permanently weaker, less elastic, and more sensitive.
So, speaking of soft tissue injuries, when I go to settle a case, let's say when a car wreck has occurred, if a chiropractor or a physical therapist has treated my client and beyond an orthopedic visit and perhaps some chiro or physical therapy, that's all they had, the adjuster will inevitably tell me, well, it's a soft tissue case. This is a soft tissue case, and we just don't pay money for soft tissue injuries. How can you help other attorneys like myself, and what can you give us to arm ourselves to tell the adjuster, hey, here's what a soft tissue injury really means, and here's why it's painful, and here's why it's worth the dollar figure that we're putting on the case.
All right. I think inherent within all business models, there's always going to be a reality and there's going to be a bureaucracy. And there's going to be inherent limitations within the business of personal injury. And the insurance companies will fall back on studies that minimize the residuals from a soft tissue injury. Let's note that most of those studies are funded by the insurance industry in its own right. And we're not here to beat up on the insurance industry. They are a partner in all this also. And there's a little sign in our office that says the insurance companies are our customers also. So when we understand all the variables inherent within the personal injury industry, if you make the priority getting the patient better, getting them well, and you document, and you justify the injuries, a good law office such as yours, and I've seen the work done, goes to bat, and when they can explain the permanent residuals of scar tissue and adhesion, such like we said before, being the joint is now going to be permanently weaker, more sensitive, less elastic, you stand a much better chance of getting your patients what they deserve. We also coordinate care. And healthcare is not just a single specialty approach, even though good healthcare is always a partnership between the doctor and the patient. But not any one doctor can treat a patient all the way through, especially after a trauma. So we always coordinate. We refer out for imaging, MRIs and CTs and X-ray when needed and when appropriate. We always coordinate with interventional pain, orthopedics, extremity orthopedics. So we do what we do, they do what they do. And together, the patient gets better faster.
At what point in your course of providing chiropractic treatment, in your experience, do you feel it's appropriate to say, hey, perhaps I'm not the right guy or gal to get this patient better. I have reached my limitations as to exactly what I can do and what I'm qualified to do.
To be honest, very rarely do we run into a scenario where we say we're not the right people. If we look at healthcare from a fragmented standpoint or an either-or standpoint, it's us or them or another specialist, then that rationale comes into play. But if you approach healthcare from a layering standpoint, we're going to do what we're going to do. We're going to treat the patient within the scope of our practice. We're going to do joint manipulation, mobilization, some physiotherapeutics. We're going to add or layer additional specialists, MDs, orthopedics, pain management, physical therapy, and as you layer health care, the patient gets better and gets well faster. If there's a patient that enters the office and they have a condition or a situation that is outside the scope of our practice, we feel is life-threatening or needs immediate attention, then the patient is referred out immediately. There are times when patients come in and we say, "You're not a chiropractic candidate." We're not afraid to do that. We love doing that, as long as they end up in the right office.
Talking about kind of layering healthcare, looking at it like it's a pyramid, so to speak. Do you feel that in a personal injury setting that chiropractic treatment should be the base of that pyramid? And if not, where do you think chiropractic treatment fits in along that pyramid or that spectrum?
That depends on the specialist, and because we tend to group physicians and doctors and healthcare providers in a generalized way. And all doctors are individuals and specialists, and some are better at some things and not so much at others. If the chiropractor that you see is expert, knowledgeable at the coordination of care, if a patient enters in their post-trauma head-on collision airbag deployed, they're post-concussive, but there's no ER, perhaps a CAT scan to rule out intracranial hemorrhage or a bleeder is appropriate. We do that. An MRI, we do that. And then we refer the patient to the appropriate specialist, all in the meanwhile rehabilitating the patient.
So let me talk about some just challenges that I have. I hit on negotiating with adjusters a minute ago, but part of what we do in a personal injury practice and what a lot of personal injury attorneys do is try cases because, we don't always see eye to eye with the insurance company. Actually, rarely do we see eye to eye with the insurance companies. But as you said, they are a necessary evil, so to speak. I mean, they're your customer, but if insurance companies paid out every claim they were supposed to pay out and put fair value on every case they were supposed to put fair value on,
then you wouldn't be in business.
Right. There would be no need for me. So
that's correct.
Let me give you an example. I'm trying a case, and before the case starts, we have to pick a jury, which is where we're asking prospective jurors a number of questions about their biases and their life experiences. And if I have a case where the client whose case it is has had chiropractic treatment, it's always a question I'm going to bring up. Raise your hand if you've been to a chiropractor. Half the jury pool will raise their hand. The other half will say they've never been to a chiropractor. And inevitably, the people who've never been are the same jurors who will say, I would never go to a chiropractor. That bias against chiropractors is something that a lot of personal injury attorneys have to overcome. And I think the reason why there is such a strong bias among a portion of the population is lack of understanding as to exactly what chiropractic medicine is. So, explain to our audience, the portion of our audience who has that lack of understanding, exactly what you do and why it is so beneficial to your patients.
Let's start at the beginning on old myths die very slowly. And chiropractic relatively it's not a new profession. Actually, manipulation of the joints, mobilization of the joints, it's been in just about every single culture and civilization since we can go back in time. Sometimes there's the myths are propagated through financial reasons. The AMA waged a huge battle against chiropractic, and for various reasons, and probably one of the first one is economic. If they're not in a medical doctor's office, then they're in a chiropractic office. If they're in a chiropractic office, where are they not? They're not in their medical doctor's office. That's number one. And that, the AMA has stepped up, and we've got to give them credit. They do acknowledge the benefits of chiropractic. Also, from an outside-the-box look, a lot of patients will go to a chiropractor when they've gotten no results from the medical doctor, and vice versa. So doctors, when they're not in tune and they don't communicate, tend to see the other profession's mistakes, and they create judgments on that. Medicine has so much knowledge accumulated today that not one doctor can know everything. And ergo, so we come up with specialists. And specialists tend to be fragmented and isolated within their own world. For any specialist who is willing to step outside their box, investigate, learn more about all the other specialists, their eyes get opened. They open their arms. They make the referrals. They receive the referrals. Chiropractic, it's quite simple. The body needs proper vascular supply, blood supply, and nerve supply to function as well as it can. The spinal column houses the spinal cord, the nerve roots. And the purpose of the vertebral column is to protect that and to maintain mobility. When a joint is misaligned or moves out of position, it fixates, it locks up. It can, at times, interfere with the vascular supply and the nervous supply to the rest of the body. What the chiropractor does is it restores motion to fixated joints, restores motion to joints that are biomechanically dysfunctional. And in restoring that joint motion, you can rehydrate discs, you can restore nerve flow, you can reduce nerve impingement, patient feels better. And that leads us to the understandable, some of the myths that have come up through the ages. Patients have gone to chiropractors, gotten what we call an adjustment, and had amazing results. Visceral responses, ear infections, asthma, gets better. Is there a scientific proof for that? The medical profession requires a scientific proof. And we haven't come that far in medicine to be able to prove that. So if you look at all the obstacles that's been against chiropractic through the decades, the fact that it's as popular as it is now and as accepted, that's a proof in itself that it works. But you have to not point a finger or take the blame or put the blame on anybody, but if all specialists, not just chiropractors, but physical therapists, medical doctors, MDs, DOs, would take the time to learn about the other specialists, and they started to coordinate care and make the referrals when appropriate, we'd have much better results and less infighting.
You talked about popularity of chiropractic medicine. I would agree with you. Any small office park I've gone into is full of chiropractors, just as they are full of attorneys. Perhaps the Atlanta market may be one of the most saturated markets with chiropractors and attorneys. At least that's what I've noticed. Perhaps I pay more attention to it because I'm an attorney and use chiropractors in my practice. Because there are so many options for patients and for attorneys, what makes your practice better than those other options?
That's a difficult question because we prefer not to compare and contrast. We stay focused. We do have our core values in our own practice, and everybody who walks in that front door is a human being first, a patient second, and a file third. We minimize, keep to and limit any administrative or business aspects in our office. We focus on patient treatment. And so our attempt and what we strive to do every day in our practice, not only through me, but our front desk, it has to be, there's a unity in the practice. We want to humanize healthcare because as people, and our listeners will vouch for this, healthcare, as the months go on and the years go on, it's less humanistic. It's more about a nurse practitioner or an MD tapping on a little iPad, and a computer, documentation. And what's happened now is this is what's happened. The healthcare profession now has to practice insurance and then do healthcare. When I first started out, we could practice healthcare and do the insurance. But now you have CPBs or corporate policy bulletins from health insurance companies that say, well, if you want to do this, you have to do that. You can only do this. But you have to do that first before you can do that, which is one of the reasons why in our practice, why do we love doing personal injury? For various reasons. Number one, we're good at it. We coordinate care. We get the imaging and we refer out to other specialists that we've created. We have worked hard to create great relationships with. I've taken it upon myself to watch interventional pain, epidurals, facet injections. I've done manipulation under anesthesia. I've watched back surgeries. My better friends are orthopedics, pain docs, anesthesiologists. We share data. I had an anesthesiologist tell me one day, he goes, all what we do when we do interventional pain is help you do what you do so that the patient can get better. That was refreshing. But without that interventional pain, my treatment sometimes will hit a plateau. So I enjoy the integration of medicine into my practice.
I think anyone who's ever been to even their primary care physician, but certainly an orthopedic or even a pain management physician can attest to, hey, I sat in the lobby for half an hour. I went back to the room. I talked to the PA or the nurse for a couple of minutes. The doctor comes in. They give me 60 seconds of their time, and they're out the door. How is your practice different in terms of client or patient contact, patient communication?
We've been so fortunate over the last 31 years, and I know I'm dating myself here, to create an environment, like I said, that's humanistic. And, for example, we don't take appointments in our office. We're first come, first serve. We have a new patient's been in a trauma that's hurting, needs to be seen. It's an immediate appointment. So we're open from 11 till 7, Monday, Wednesday, Friday. We do put our patients on a schedule. If they're on a rehabilitation schedule, we'll see you every Monday, Wednesday, Friday, or every Monday, Friday. But they can present at any time between 11 and 7. So for us, convenience is big. And if you take a look at healthcare today, and I'm not, antagonistic towards the healthcare profession, but I've been in that scenario where, I have an 11 a.m. meeting with the pediatrician for my daughter. And there's a sign that says, if you show up late, you owe us $50 for a late fee. So I'll stress out, get everything ready, and I'll show up 5 minutes before, but I will sit in that waiting room till 11:30, sit back in the room for another 15 minutes, and when I leave, I do feel like saying, you owe me $50. Okay.
You ever get to collect on that 50?
No, it never happens. It's so in our office, we look at the deficiencies of the system. Convenience is a big thing, especially in this town here. You get one vehicular collision or a bad storm and traffic gets backed up, and stress is not good for rehabilitation.
Let me switch gears for a second and talk about another challenge that I have as a personal injury attorney. So same scenario where I have an injured client, and instead of going to a chiropractor post-accident, what I do is I speak with them, I get their medical records, and I find out they've been going to a chiropractor for 3 years, 5 years, but they're going for wellness visits. And the defense attorney will take that wellness visit and use it to make my client appear that they have a significant amount of pre-existing conditions, and look, they've been treating with a chiropractor for this entire time, and obviously all of these issues that they're now claiming that are related to this motor vehicle collision or slip and fall were there prior to this whatever incident. So my question is, how can I, as the attorney, explain to a jury that, well, what exactly a wellness visit is and how that's different from treating, every few weeks or every few days for intractable back pain or neck pain?
Well, there's a saying, it's easier to stay well than it is to get well. So there are a large part of the population that understands if you go to the chiropractor on an intermittent basis, whether it be weekly, monthly, whatever your lifestyle dictates, that it's easier to stay well than it is to get well. And if the chiropractor and the doc documents the file such, it is a supportive care visit. It's a wellness visit. You should have less of a problem with that. But take into consideration that the defense attorney, I believe, is always going to look for something.
As they should. I would,
Yeah.
would too. But, when you say wellness visit,
when I say wellness, just because you bring your car in to get the oil changed every 5,000 miles doesn't mean that you have an oil leak. You're maintaining, it's a supportive care visit.
What types of ailments or issues or just common everyday things can you treat at a wellness visit?
Well, I don't believe anybody lives in a bubble. If you'd seen my wife and my daughter this weekend doing the gardening out in the yard for Mother's Day, the plants, and at the end of the day, both of them achy, a little hurting. From what? From doing things that they wanted to do, love to do. It's part of life. So treating those kind of patients to maintain a level of health care, that's an appropriate approach to health care. That's wellness, that's supportive care.
So just looking back, Doctor, over your 31 years of practice and treating patients of all ages, what do you find to be the most common cause of neck and back pain that afflicts the population and interferes with just their everyday quality of life?
There's no doubt about what the answer to that is. There are so many variables that come into play with an individual's health care, level of health. Genetics is one, occupation is another, history of injury and trauma, I would say, is number one. And here's the 5 most dangerous words. Maybe it will go away. So nobody's a Superman and nobody's a Superwoman. If you incur a trauma, whether it be an auto accident, a slip and fall, it's a necessity. You seek the care from a very good, reputable chiropractor who will do an assessment, evaluate, manage, and start you on a good course to rehab. When you look at the sequel, what happens after an injury, and we talked about the bleeding, right? For the first few days, it's the bleeding. If you ice after that, and the magical time frame after an injury is 4 to 6 weeks, that's when the majority of that scar tissue and adhesion is going to lay down within and around the joint. If that's not directed in the first 4 to 6 weeks, then there's catch-up or there's a limitation to how much improvement can be made in the future. So depending on the magnitude and the nature of the injury, the first 4 to 6 weeks is crucial. So over 30 years, what I have the benefit of seeing as I go from room to room up and down my hallway, I can see so many different patients of so many different ages, whether they're 12 or they're 22 or they're 50 or they're 70. And when you take that history and you realize that they did have a head-on collision or they did have a rear end or they did fall down the stairs, but they did not rehabilitate. They did not go for that to get evaluated and treated. What happens is it starts, it's like a snowball effect. If you take a huge snow-covered mountain, take a little snowball and push it off the top of that mountain, what happens is as it starts to roll down the mountain, it picks up more snow. The more snow it gets, the bigger it gets, the faster it goes, the more snow it gets. So then they end up in my office and they're 5 years, 10 years, 15 years down the line. And what started as a little snowball is now a degenerative disc, nerve impingement, leg pain, leg numbness, arm pain, numbness, tingling into the hands or the fingers. And if they would have rehabilitated immediately after that auto accident or that bad fall or that trauma, that injury, that sports injury even, they would not be that far down the road. So over 30 years, you get to see what happens when you don't rehabilitate.
Thank you, Doctor. Real quickly, wrapping up here, tell people how they can find you and treat with your office.
Oh, we're in the Smyrna Vinings area. It's now called the Emory Smyrna campus. It's Emory it was Emory Adventist Hospital. Now it's Emory at Smyrna. And we're there, and we've enjoyed it for the last almost 16 years. And
what's the phone number?
770-434-8976.
So that's going to do it for this episode of Law and Medicine. Thank you so much for listening. If you're in Georgia or in the Atlanta area and you've been injured either on the job or as a result of someone else's negligence, please give our offices a call, 678-534-1980. And again, my name is Matthew Wilson. Thank you for listening.
Thank you again for joining us and our guests on the Law and Medicine Show. Use the social media links here to share today's show and stay tuned for the next episode of the Law and Medicine Show, brought to you by the law firm of Princenthal-and-May. To connect with the show's sponsor, visit princemay.com. And to listen to previous broadcasts, visit lawandmedicineshow.com.